I am Dean Bartholomew. I'm a family physician in Saratoga, Wyoming. We have a small rural clinic here and provide care for a population of anywhere from 2,000 to 2,500. Our clinic has 3 providers, myself, and then I have a PA and a nurse practitioner. We cover a 40-mile radius, basically, with Rawlins being 40 miles away, which is the nearest hospital and other clinic. I feel absolutely on my own when I'm out here. In a big city where you might have a whole team, a hospice team or a palliative care team, a lot of times it's use the provider or a nurse that works in your clinic, and we're providing that care sometimes during the daytime hours when we're supposed to be in clinic, but a lot of times it's care that we're providing on our own on an evening or on a weekend. I think a task force would be beneficial for several reasons. One is just from an education standpoint. I think that we need to get out to other providers, ideas and kind of best practices. As a small rural provider, you just don't have time to go and recreate the wheel on these kind of issues. And I think we've done some things here in Saratoga that could be replicated, and I would love to share our story, and definitely I would love to learn how others are doing it too. And second, from a legislative standpoint, sure, we're looking at what can we do better. Payment is definitely an issue. In terms of Medicare, Medicaid, and some of the big payers, they'll pay for palliative care, especially under hospice care. But there's only a handful of communities that have bona fide hospice facilities or groups that can provide that care. In us small communities that don't have the staff to have a full-time social worker and a pastoral staff and nurses, we don't get paid to do what we do at the home. I love palliative care because when you talk about coming alongside a patient, and especially coming alongside the patient's family and helping them through that point in their life where things are stressful, there is chronic suffering, there is chronic pain, and if you can help them through that process, we all know it's going to happen. We all know that a patient is either at a stage in their life where things are going wrong or going bad, and then we know we're heading towards death. If we can help a patient get through that to where there's less suffering, less pain, less stress for the family, boy, I don't think there's any other way that you can really help a patient out other than doing that. You're talking about ranchers who've been here for 3, 4, 5 generations, and the last thing that they want to do is to pack up and go to a hospice home, which is great, but to be 2 hours away from the ranch that they've been on since they're this small, and that's where their family is. They don't want to do that. They want to be at home. They want to die at home.